Today, we are going to discuss how Thrive uses science and anatomy to get the best alignments for their patients. The key to getting the most precise alignment is to be able to see the exact misalignment, make the necessary corrections, and then be able to recheck and make sure that those alignments were fulfilled perfectly. At Thrive, we do this by using the body's own proprioceptive mechanoreceptors called Golgi Tendon Organs. The body is so perfectly and beautifully made that it has a built-in system for everything. These little Golgi tendon organs are located in every tendon of every muscle of the body. Their only function is to send information back to the brain about the amount of tension on that muscle. By using a series of challenges and pre-checks, the doctor at Thrive Chiropractic is able to use the Golgi tendon organs to find the precise misalignment on any joint. This allows us to make changes that will get better relief and faster healing. Here's how it works in a little more detail. The doctor challenges the joint and gets an immediate response about whether the segment that was tested is doing its job correctly. He's able to test the joint in many different directions to see which way the segment is misaligned. This is all possible because the Golgi tendon organ reacts differently on segments that are misaligned compared to those that are aligned correctly. Following a precise correction, the doctor is able to recheck the Golgi tendon organ to make sure that the correction realigned the segment perfectly and there is no response from the muscle. This procedure cannot be done by a machine. It can only be done by an experienced doctor that has practiced and perfected the procedures. Using these miraculous little mechanoreceptors, the doctor is able to find segments that are out of alignment that the patient doesn't even know that they're having a problem with yet.
Here's a great example of how Golgi tendon organs help us to find misalignment and recheck that the alignments are perfect after a correction has been made. Here, we have a patient with a misalignment of their occiput. So when we challenge the occiput and push it farther into misalignment, we notice that there is a severe shortening of the left leg compared to the right leg. This is the action of the Golgi tendon organ. By pushing the misaligned segment farther into misalignment, we activate a sort of fight or flight response from the Golgi tendon organs as they change the way the muscles protect the area that we are potentially assaulting. A correction is made, and now we can challenge that exact same segment with no response from the feet whatsoever, because now the Golgi tendon organ does not see any type of risk in overstretching the joint. So no counteractivity is noted.
By fixing problem areas before they become symptomatic, the doctor can keep you feeling better longer.
Are you ready to thrive instead of just survive? Let's get started.